welcome to Let's Talk Health Live. I'm Dr. Amanda. I'm a naturopathic doctor, and I host these live Q&A chats to answer any health questions that you might have. So today's live chat, I'm going to be talking about different supplements, but feel free to ask me any other questions, whether that be a health concern, a condition that you have, if you're curious about lab testing, whatever it goes, and ask me anything in the chat, and I'll be here to answer your questions. If you have never joined these live chats before, welcome. Feel free to join our community. So subscribe, like the video, and follow along to learn about different health things and how you can improve your health. So any health questions, just feel free to drop them in the chat. So I wanted to talk about the supplement called CoQ10. So the other day I was at Costco, and they, you know how Costco always has samples, and a lot of people like going to Costco for the samples, and yeah, it's fun. But they had a sample of CoQ10, a supplement. It was in a liquid form, and the guy was offering people the drink to try out the supplement to see. So I wanted to talk about CoQ10 because I've been seeing that supplement circulate a lot more on social media. Let me know in the chat if you've heard about CoQ10 or if you're taking it. So CoQ10, its full name is called coenzyme Q10. Your body does produce CoQ10, and it resides a lot in our mitochondria. So our mitochondria, I'm sure most of you know from school and biology, our mitochondria are the powerhouse of the cell. So they basically help with producing energy. So in CoQ10, what it does is it helps with producing energy. ATP is the energy for the cell. So if you take CoQ10, it can help your body with producing more of that energy for the cells. So that's one reason why some people take it, is to help with cellular function and energy and performance. It can also be really good for fertility. So for if you're trying to get pregnant, it's good for like egg quality health. It's good for sperm quality. So CoQ10 is another really good thing for that. What else? It's good for cholesterol. So I commonly recommend this to patients that are taking cholesterol medication. So anybody that's just joining us, hi and welcome. I'm Dr. Amanda. I'm a naturopathic doctor, and tonight we're talking about different health supplements. I'm currently talking about CoQ10. So for cholesterol, if you have high cholesterol, especially if you're on cholesterol medication called a statin, that actually depletes your body's levels of CoQ10. It depletes your body's own CoQ10. So taking CoQ10 can be really beneficial if you have high cholesterol and if you're on statin medication. So it's great for supporting heart health. So whether that be cardiovascular disease, diabetes, high cholesterol, it can be very beneficial. In terms of the dose or the form, so a general dose is going to be 100 to 200 milligrams. 100 is, I would say, the needed, like the dose that's needed to see some effect. You don't want to do anything lower than that. Whereas in some cases, you could even take higher. So usually in fertility cases, you can take higher doses of CoQ10. It can be really beneficial for like the egg and the sperm health. But if you are on statin medication, if you have high cholesterol, doing the 200 milligram dose would generally be sufficient, and that can be beneficial. If you have chronic fatigue, CoQ10 is a great option as well. It's usually paired with some other nutrients like alpha lipoic acid. Can be really good. Yeah, so that's helpful. That's CoQ10. So if anybody's just joining us, welcome. We're talking about different health conditions here. All right, there is a question. Is liquid form best? That's a good question. So liquid form can be helpful because it can be absorbed easier, because your body doesn't have to go through, breaking down that capsule and absorbing it. So that can be beneficial for some people, especially if you don't like taking capsules, or if you forget to take them, because some people just don't like taking so many pills. The liquid form can be beneficial. So I wouldn't say one form is best than the other, but I would say that the liquid form can be absorbed better. On the other hand, if you do it in a capsule form, you could actually get them in soft gels, and that will help with absorption too, because it will have fat that will help with absorbing it. So yeah, great question. Thank you for the question. All right, if you're just joining us, hi and welcome. I'm Dr. Amanda, I'm a naturopathic doctor. Be sure to like the video and subscribe and join along our health community. I am doing live health chats to answer any questions that you might have. So I really do appreciate the likes, thank you. It does help get the video noticed and boosted across the YouTube algorithm. And right now I was talking a little bit about CoQ10. So if you have any questions about that, feel free to drop it in the chat. I'm curious if anybody is taking CoQ10, what you're taking it for. The other good thing it can be really helpful with is it's like a really good antioxidant. So helping protect your cells from free radical damage, which can just be things like in our environment, like smoke, pesticides, foods that have been highly processed. These can all just affect your cells. So CoQ10 is a really good antioxidant that can help out with protecting your cells from those from that oxidative damage. And it's a fairly well-tolerated supplement. Like I haven't had anybody tell me that they have side effects from taking CoQ10. I mean, of course, if you have any health concerns or on any medications, just double check with your primary care provider before starting any supplements. But it is a pretty well safe and tolerated supplement. Okay, thank you guys so much for the likes. I really appreciate that. If you're just joining us, hi, I'm Dr. Amanda. I'm a naturopathic doctor. I host these live health Q&As to answer any questions you might have. So we were chatting a little bit about CoQ10 and how it's really good for energy production, how it's great for helping out with fatigue and chronic fatigue, and really good for cardiovascular disease. So that can be like diabetes, high blood pressure, high cholesterol, especially if you're taking a statin medication. So that's a medication for high cholesterol. CoQ10 can be really beneficial. And you want to get it at a therapeutic dose of around 200 milligrams a day. If you're using it for something like fertility concerns, because it can be really good for egg health and sperm health, you can do even higher than that. You can do like 400 milligrams a day. So yeah, that's CoQ10. Let me know if you have any questions about CoQ10. I'm just going to see if I had anything else I wanted to chat about that. I think that's the main thing, and yeah, it can be a really great supplement to add to your routine. Fairly cost effective too. It's pretty cost effective, CoQ10, and we had some questions about is it better in a liquid form or a supplement capsule form. So I'd say the liquid form is pretty good for getting absorbed, and if you get it in a capsule, you can get it in a soft gel where it has a fat base in it, and that can help be absorbed as well. Okay, so I'm just seeing some new people joining us, so hi and welcome. Thank you so much for the likes. I'm Dr. Amanda, naturopathic doctor. I host these live health Q&As to answer any health questions that you might have, so feel free to drop any questions in the chat. I'm going to be chatting about some supplements, but you can ask me anything health related, whether that be, if you have a health concern that you were curious about, what can be helpful for it, or if you were curious about lab testing or different types of tests, let me know. Okay, the next supplement I wanted to talk about is called inositol. So inositol is a molecule that it's actually kind of like a sugar molecule, very similar to some of your B vitamins, and inositol can be beneficial for many different things. One of the main things it's been known for helping with is insulin resistance and helping out with hormonal balance. So inositol is generally you're going to have to take it in a powder form because you have to take about 4 grams to get a beneficial dose. So if you were going to be taking that in capsules, you'd have to take like a lot of capsules. So inositol in a powder form is really good. So if you have diabetes, insulin resistance, it can be really helpful for improving insulin sensitivity, and it's specifically helpful for people with a condition called polycystic ovarian syndrome, or PCOS. So that's females that have this condition where they're not able to ovulate, they have insulin resistance. So it's really helpful for that condition because it can make the body more sensitive to the blood sugar and help improve ovulation as well. The other thing that can be helpful is for gestational diabetes, which is diabetes in pregnancy, so really beneficial for that. and then just general diabetes or insulin resistance. So if if you have any of those conditions, or you're curious a little bit more about this supplement, I'd highly recommend looking into it. There's different forms. There's the Myo and then the D-Chiro. Generally, if we're just looking for insulin sensitivity support, the Myo is what can be helpful. If you're looking more for the fertility, ovarian support, the combination of Myo and D-Chiro and inositol can be really beneficial. Okay, so anyone that's just joining us, hi and welcome. I'm Dr. Amanda. I'm a naturopathic doctor. I host this live health Q&A to answer any health questions you have. So I was talking about some supplements. I already spoke about CoQ10. I spoke about inositol. So those were two really great supplements. Right now, I'm just going to go through the chat and see if there's any questions, but feel free to ask me any questions about your health concerns, your supplements, lab tests, whichever you want to know. And thank you so much for the likes. I do appreciate that. It really does help get the video noticed across YouTube. And if you aren't part of the community, make sure to subscribe, and that way you know when I go live and I can help you out with your health questions. Okay, how often should one eat eggs? Is yolk or white better? That is a really good question. I would say eggs is something you could eat daily. It's got a really high quality, good source of protein. It's got a ton of nutrients. Eggs are really high in a nutrient called choline, and choline is great for brain health and for cognitive health. So they're one of the foods that has the highest amount of choline, so really good there. Healthy fats are part of that, omega as well. So I'd say that's something you could eat every day. If you like eggs, great. Is the yolk or the white better? Great question as well. They're both important, and they're both important for different things. So the choline that I mentioned and a lot of like the vitamins and minerals and nutrients are going to be in the yolk. The yolk is really high in choline and some of those other vitamins and minerals, whereas the white part is high in protein. So that's what's going to have the higher amount of protein. So if you have a combination of yolks and whites, then you're going to get the benefits of both. Some people like the egg whites because of the high protein. So I would say just still try to have the yolk so you get all those nutrients and all those minerals that I mentioned. But you could then add like more egg whites on its own if you wanted to increase the protein, and if you were maybe watching your fat content, because the yolk is what has a lot of fat in it. But yeah, great question. Both of them are really good and important for different things. Okay, I'm dealing with pebble stools again. I have methanol SIBO. Do you think that the elemental diet will be more effective compared to, and I think company means compared to antibiotics? Okay, so methanol SIBO means like the high methane SIBO. So SIBO, for anybody that's not familiar, is small intestinal bacterial overgrowth. So basically what happens in your gut, your small intestine, you get an overgrowth of bacteria, and that can cause a wide range of symptoms: bloating, gas, can be either diarrhea or constipation, can be abdominal pain, feeling unwell, fatigue, brain fog, like a lot of gut issues. So that's what SIBO is. And the question is if the elemental diet will be more effective. So I would say that it can be beneficial, but you'll still want to do some sort of antimicrobial or antibiotic support. So if you're going to go the route of doing antibiotics, rifaximin is what's been studied best for SIBO. If you want to do like more like natural antimicrobials, you can do like a combination of essential oils, things like thyme, oregano, golden seal, a combination of that, and then the elemental diet in addition to it. So I wouldn't say on its own it would be effective enough. I think you need a antimicrobial support or antibiotic support in there. And then of course probiotics can be beneficial as well. If you're having those really pebbly small stools, just making sure you're hydrated, trying to get fiber as well. And you maybe need to do either the low FODMAP or the elemental diet to see which one works better for you. But yeah, great question. If anybody's just joining us, hi, welcome. I'm Dr. Amanda. I'm a naturopathic doctor. I host these live health Q&As to answer any health questions that you have. So right now I'm just going through the chat and answering questions, but feel free to ask me anything in regards to supplements, a health condition, labs, any questions that you had. And thank you so much for the likes. I do appreciate that. It does help get our video noticed, because the more of you that come and ask questions, then everybody else can learn, which is great. And then also be sure to subscribe and join the community here so you can get notified next time I go on live. What kind of exercise is best for getting rid of belly fat? Okay, good question. I think a lot of times we think, okay, fat in the belly, we got to do crunches, which can be helpful, but full body or exercises that you're going to build muscle mass, but for your bigger muscles, can be really beneficial for toning your overall body or building muscle overall in the ab area. So something like squats, deadlifts, these are exercise that are going to use like your quads and your glutes, which are main muscles of your whole body, like pretty big muscle groups. And you're still going to use your core to help out with that too. So if you do like squats or deadlifts and you activate your core muscles, that's going to be really helpful for the belly area and for improving muscle mass in the belly fat. And then of course doing targeted core exercises can be beneficial as well. So whether that be doing planks, some sort of ab workouts can be helpful. And then actually what's really good is going to be the cardiovascular exercise, because when you're moving your body, you're moving your legs, you're running, you're walking, you're swimming, cycling, doing some sort of cardiovascular exercise is going to help with overall losing weight, which is going to help with losing the belly fat. So great question. Thank you. Okay, let's continue. How can someone heal or lessen abdominal adhesions naturally? That's a good question. And the one thing I would say that comes to mind for that is potentially doing castor oil packs. And in your case, you mentioned you have more pebbly stools. So castor oil packs can be really helpful for helping movement through the intestines. And if there is any like scarring, adhesions, can be beneficial for that. So if you're not familiar with castor oil, it is used topically. So you put it on top of your abdomen, you can rub it in, and then you can buy castor oil blanket pack kind of thing. You put it around your abdomen, and then you can put a heat pack on top, let the oil absorb in, and then leave it on overnight if you wanted to do that, or you can leave it a couple hours a day. You can find the instructions online when you purchase the pack, but what it can do is, like I said, help movement through the intestines, and it can be really, really helpful and beneficial for that. Okay, so if anybody's just joining us, hi and welcome. Welcome to Let's Talk Health. I'm Dr. Amanda. I'm a naturopathic doctor, and I'm here to answer any health questions. So I host this live Q&A to see, what's going on, if anybody's curious about any health conditions, supplements. So far we've been talking about CoQ10, inositol, these different supplements. So now I'm just going to go through the chat and see if there's any other questions. Are enemas bad to do more than once a week? Are water enemas safe and won't give me electrolyte imbalance? So enemas is not something that I've ever really recommended doing. Some people find them helpful, but I don't think it really is one of the best options to do. It can create some, as you mentioned, electrolyte imbalance, microbiome imbalance. If anything, it's going to cause, maybe some more issues than helping. So it's not really something natural that I recommend doing. I would say if you're feeling like you need to do something like that because you're feeling so backed up, you want to just look at go back to the basics. Are you having enough water? Are you having enough fiber in your diet? what's your microbiome like? Are you taking the right strains of probiotics, or is there an imbalance going on? Do you have overgrowth of bacteria, which in your case potentially you did because you asked the question before. I try the castor oil packs over something like an enema because it's very gentle. You're just putting castor oil over your abdominal area, and it's very gentle. It's not going to interfere with any of the imbalances. Yeah, you're so welcome. Thanks for asking the questions. And anybody else that's just joining us, we have some people saying hi. So hi and welcome. I'm Dr. Amanda. I'm a naturopathic doctor. I host this live health Q&A to answer any health questions that you have. So feel free to ask me your questions in the chat. Thank you for the likes. I do appreciate that. It really does help get the video noticed across YouTube. So if there's any other questions, just ask them in the chat. I've been talking about different supplements and how they can be helpful for different things. I was talking about CoQ10 at the beginning, so if anybody was interested in that, I was just kind of mentioning how CoQ10 is really great for energy, for mitochondria health, for supporting cardiovascular health, so really good if you have any cardiovascular disease. And then I also mentioned inositol, that is a supplement that's really good for helping out with ovarian function, ovulation, and insulin resistance. How much protein is too much protein? And I think that's a good question and a good thing to mention, because too much protein can be hard on the kidneys. Like, your kidneys have to filter out everything, and a lot of protein can impact that. So I would say that actually depends on how much you weigh, because everybody has different protein requirements. So there's, some studies that say a gram per, at least a kilogram per kilogram of how much you weigh would be like the minimum that you want to get. So let's say you weigh 50 kilograms and you want to be getting at least 50 grams of protein. I would say then, like, on the mid-range, about even like 1.5 grams per kilogram would probably be better, or a more ideal range to get. And then some sources say like a gram per pound, but that's actually pretty high, that a higher amount. So just being cautious about protein and how much you're having, looking into how much you weigh and what your requirements would be based on that. Yeah, so that's a great question. Generally, you want to be getting at least a gram per kilogram. Yeah. All right. Okay, so I think right now that's all the questions that were in the chat. So if anybody has any other questions, feel free to drop them in the chat. We were talking about protein, but I think one of the other nutrients that's commonly not talked about enough is fiber. And I've talked about fiber quite a bit before, but there seems to be this craze of like trying to get a lot of protein in the diet. And I agree, protein is important because it's going to help your muscle mass. It's going to help with blood sugar balancing, because the way your body breaks it down compared to carbohydrates. But the other thing that we tend to forget about is fiber. If you think about our diets, or like the standard American diet or the typical diets, they're usually pretty good in protein. Like if you think about steaks and burgers and chicken and what majority of people eat, you're probably getting some protein in there, but are you getting enough fiber? And I'm going to tell you, probably not getting enough fiber, just from what I see in practice. And I'll be honest, like some days I know I don't even get enough fiber either. So fiber is going to be in a lot of your vegetables, but you got to think about the vegetables that are like broccoli, Brussels sprouts, cabbage, spinach, what else? Carrots. Like those are going to be your high fiber foods. Whereas something like lettuce and tomato and cucumber and like things that are typically in a salad, they don't have a lot of fiber. Nuts and seeds have a lot of fiber. Legumes, so lentils, chickpeas, really good sources of fiber. And then your grains, things like oats and stuff, will have fiber as well. But in your diet, you probably aren't getting enough. You need like at least 25 grams of fiber a day is what's like generally recommended. And fiber is going to be really good for your gut health. So it's going to help with regular bowel movements. It's going to help with binding and getting rid of excess toxins in the body. It's going to help with blood sugar for sure, because fiber is slowly absorbed. So helps with preventing blood sugar spikes. Good for cholesterol, heart health. So it's really important to get fiber. And I don't think we talk about that enough. And there's always this like talk about protein. But I think it's important to have a balance of both. All right, so anybody that's just joining us, I'm just seeing some new people hopping on. So hi, welcome. I'm Dr. Amanda. I'm a naturopathic doctor. I host these live health Q&As to answer any health questions that you might have. So thank you for joining. Thank you for the likes. I do appreciate the likes so much. It does help get our video noticed across YouTube. And if you are new here, be sure to subscribe and join so you know when I go live and I can answer your health questions. What is a good fiber, low carb food? That's good question. Yeah, I would say like something like broccoli, or most green vegetables, kale, spinach, are going to be high in fiber, and they're generally lower carbs. Whereas something like oatmeal is pretty good in fiber, but it's going to have a higher carb. So yeah, if you're looking for like good fiber, low carbs, any of your green veggies are going to be the things you want to get, go and get for sure. Yeah, great question. Yeah, so in order to have like a balanced, like an ideally perfect balanced meal is going to have a combination of protein, fibers, and fats. And that's going to be the best 3 things to help with heart disease, diabetes, hormone health, energy, really anything. That's like the 3 best things you want to have. So protein would be, sorry, I need a second. Protein would be like your meats. So whether that be beef, chicken, turkey, salmon, fish, eggs, like those are going to be your high protein things. If you need like vegetarian sources, edamame is generally a good one, or soy products. And then fiber, so any of those veggies we talked about. So broccoli, Brussels sprouts, cabbage, kale, spinach, carrots, sweet potato, what else? Nuts, seeds, beans. Those are going to be your high sources of fiber. And then the fat is going to be like avocado, olive oil, fish are pretty high in fat as well. So you want a balanced meal. If you had something that had all of that, so for example, if you're doing, let's talk about like breakfast, if you're going to do eggs, that's going to be your protein source. You want to add some fiber in there, so maybe you're going to do some spinach, maybe some onions, bell peppers, kale, and then for your healthy fat, you can do like avocado. So that would be a pretty good and balanced meal. All right. If there's any other questions, anybody that's just joining us, hi and welcome. I'm Dr. Amanda. I'm a naturopathic doctor. I'm here to answer any health questions that you might have. So I'm going to hang around for a few more minutes and answer any questions that you want to know, whether that be a supplement, a health concern, a lab test that you were curious about. Let me know in the chat and I'll be able to answer it for you. We've had some really great questions tonight, so thank you so much for the questions. Thank you for the likes. I do appreciate all of that. We've been chatting about CoQ10, inositol, eggs, protein, fiber, all of these great things. So if you had any other questions that you were curious about, let me know, and I will answer them. And if you don't have a question tonight, be sure to join me next time I go live. So do join the community and subscribe so that way you know the next time I go live and I can answer the questions for you. All right, I'll just keep the chat open for a couple more moments. And then, yeah, I'm curious, what's everybody's plans for this weekend coming up. If you want to share, what you're doing this weekend, let us know, and we'll see. I'm not too sure what I'm doing this weekend. Maybe going to the beach or somewhere for a nice walk. Barbecue, nice. Yeah, barbecue. Well, make sure you get your protein and your fiber from that barbecue. Okay. Well, thanks everybody for sharing and for joining. And if you are just hopping on, I'm Dr. Amanda. I'm a naturopathic doctor. I host this live health Q&A to answer your questions. So Be sure to subscribe so that way you know next time I go live and you can ask me your questions. I was chatting a lot about supplements tonight, good things for your heart and cognitive health. Okay. So if you have any other questions, just drop them in the chat. Some pastrami sandwiches. Okay, great. Well, it sounds like we're gonna have some really yummy food this weekend. Okay, I am going to be signing off tonight. So thank you everybody for joining, and I will see you all next time. Have a great night.